Hello. Hi, Magdalene. Magdalene Izu, how are you? Lita Staniford, how are you all doing? Thanks for joining. I appreciate you all. Are you doing well? If you once you come in, please, can you give this live a thumbs up, please? Give it a thumbs up. Give it a thumbs up. Hi, Helen. Helen, how are you doing? Are you well? Thanks for joining. I appreciate you. Thank you very much. Oh, Max Forum is here. How are you doing on Max Forum? I appreciate you. I appreciate you. Thank you so much for joining. Max Forum is another YouTuber. She's into healthy recipes, making healthy smoothies and healthy drinks. So please check her channel out and please subscribe. Okay, she has beautiful, 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 amazing videos on how to live a healthy life, how to use basically everything you have in the house, fruits, vegetables, to make a really beautiful smoothie. Okay, on Max Forum, I appreciate you. So, today's life is about hyperpigmentation. Because this is actually a very requested video. I was just gonna do it as my usual, video upload. But I was like, well, it's better for me to do it live so that I can, interact with my viewers. And because this is an issue that a lot of people have in terms of any ethnicity, actually, any ethnicity whatsoever. A lot of people suffers from hyperpigmentation. So I will be talking about what causes hyperpigmentation. I will be talking about types of hyperpigmentation and how to remedy it. What kind of treatment do you need in order to get rid of hyperpigmentation? Okay. Please, as you're coming, please, can you give this live a thumbs up? Click the like button there and support this live, please. Thank you so much as you do. So the first thing I will be talking about now is what causes hyperpigmentation. Okay, I'm going to list few things. It's a very broad topic. When it comes to hyperpigmentation, is very, very broad. But today I'll be focusing more on the beauty side, not the health part of hyperpigmentation, because I'm not a dermatologist, neither am I, a medical doctor. I'm only a skincare specialist. So I'll be focusing more on when it comes to the beauty part of hyperpigmentation. That's what I'll be focusing on. So I'm going to talk about them, like the things that I listed before: what causes hyperpigmentation, types of hyperpigmentation. I will talk about maybe few creams, even natural remedies that you can use to treat hyperpigmentation. When I finish that, then keep your questions coming as well. I had questions. A lot of people sent me questions, but unfortunately, I can't go through those questions because this is more like a teaching class. So it's going to take a while for me to finish this topic. And if I have time, I can answer those questions. But whatever questions that you send here, anybody you send here on live, I will surely make sure I answer that. Okay. Now, what causes hyperpigmentation? What is hyperpigmentation in the first place? So hyperpigmentation is more like a darkening area on your skin. Okay, some people have it. They can have it on their face. They can have it on their upper back. They can even have it on their thighs, because it's sometimes when you put on so much weight and your thighs are like rubbing each other, you could see that that place gets very like darkened, more darker than the rest of your body. You can get it on your hands. You can get it on your shoulders. Okay, so it's like some patches, some dark patches, or some area of their body that's like more darker than the rest of your body. You could see it there. You actually, when you look at it, you notice, oh, this area here is darker than the rest of my body. Some people, most of the ones that are common are on the face. The ones that are common on the face. So what causes it? Abigail Ifoma, how are you? Welcome to I appreciate you. Welcome. So please, when you come, can you give this live a thumbs up? Thank you so much. Thank you. I appreciate you. Thank you for joining. What the next thing that I'll be talking about now will be, how do you know if you have hyperpigmentation? So I'm just going to talk about the signs and what causes it. So what causes hyperpigmentation mainly? I'll list the things out. The first thing is, we have this pigment called melanin. Melanin is what gives your skin the color that you have. And the cell that produces that melanin is called melanocytes. Okay? So what causes hyperpigmentation is when that melanocytes produces kind of overproduction of melanin. When you produce too much, when your body produces too much of that melanin, then it causes your skin to darken. When it causes your skin to darken, then that is what hyperpigmentation is. So what are those things that are causing your body to produce more melanin? Because your body can't just start overproducing melanin. There are things that triggers your body to do that, to produce more melanin. So more like lessen the activeness of melanocytes. So one of the main causes is sun exposure. Sun exposure. When you expose your skin to too much sun, especially if you don't use sunscreen, you go out when the sun is at its strongest, you're not wearing any sunscreen, then your skin is now too exposed, because this skin that you see here, this melanin that produces this pigment on our skin, it can only be active over a certain amount. But when you expose yourself to too much sun, then what happens? It now affects that production of melanocytes. It affects it. So what happens then is your skin, you start to notice, have signs of hyperpigmentation. Okay, you start to have signs of hyperpigmentation, and one of those signs will be freckles. You can have more like a Caucasian skin type can have it. Freckles, white people, people that have white skin, white people usually develop that freckles or sunspots on their skin when your skin is too exposed to sun. Another thing that causes hyperpigmentation is hormonal changes, more like hormonal imbalance. And hormone is more like if for pregnant women, some pregnant women that I speak to on the phone will tell me, my face is getting darker than the rest of my body. So when you're pregnant, your hormone changes. And you can develop hyperpigmentation, especially people with darker, skin tone. You can see that your face is darker than the rest of your body. Sometimes you can even have it on your stomach. So those ones are like hormonal. Most times after having your baby, the pigment will just go on its own. For some people, if you don't treat it, it may actually linger for a very long time. Okay? Now, the next thing that causes hyperpigmentation is age. Okay? Have you noticed that sometimes when you see an older people, especially people with white skin, you see that they have loads and loads of freckles on their skin. It's like dark patches all over their skin. Yeah. So when you're getting like a bit older, you are prone to developing hyperpigmentation. Another thing that causes hyperpigmentation as well would be like acne. People that have acne prone skin. People that have acne prone skin their questions actually coming now. This life is going on. There are questions coming. Yeah, so people that have acne prone skin are very, 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 very likely to develop hyperpigmentation. Hi, Kate Grammon, how are you? Welcome, welcome. Thank you so much. Thank you so much. I appreciate you. Thank you. So yeah, those acne prone skin, because sometimes when you have those pimples, and then most people make the mistake of popping it, and then the pimple, when you pop it, you don't know that you have bacterial on your hands, because you don't know where your hands are, where you've touched your hands, and then you're using it to pop your pimples, and after that, then you get the acne infected. And when the acne dries out, you find out that it's kind of really, really dark. Okay, that is hyperpigmentation. So a lot of people with acne-prone skin are likely to develop hyperpigmentation. Okay, now another thing that causes hyperpigmentation as well is this one. I don't even know what to say again. These questions that are coming right now, I don't think I'll be able to answer these questions. Another thing that can cause hyperpigmentation as well is tanning beds. Tanning beds. Because you want to look beautiful. Yes. Tanning beds can give your skin a very, very huge, more like destroy your skin. Yeah. Can cause hyperpigmentation. If you do, I don't like, sometimes I get calls where people with darker skin tone will tell me, Chika, I want to go and have laser treatment. What do you think? I'll probably tell you, like I usually say to them, when you have darker skin tone, don't go doing any laser treatments, because darker skin tone are prone to hyperpigmentation. It's like our skin tone, anything, any little thing that we have, any cuts, bruises, it gets really, really, the pigment gets, because we are producing more melanin than people with white skin tone. So any little thing our skin gets, get hyperpigmentation. Any little thing on our skin, any bruises, whatever it is, our skin get hyperpigmentation immediately. And most times when you go having those laser treatments, it can result to you developing hyperpigmentation. Tanning beds as well. That is another thing that I wouldn't advise you, people with darker skin tone, to go for tanning. Well, we don't need tanning beds because our skin is already tan. But white skin, I'll probably tell you, it's not advisable to, to have to go for tanning. No, it's not, because those tanning beds can really, really age you. It can really, really age you, like really, really bad. Okay, someone is asking me here now that they have the hyperpigmentation. Okay, well, I'm going to answer some of the questions that are coming. I'll probably need to answer them, but that'll be when I finish talking. So, one other thing that causes hyperpigmentation is if you're on any medication. Medication can cause it. It can cause hyperpigmentation. Some medications, like I said, I'm not going to the medical part. I'm only doing the beauty part. Some medications can cause hyperpigmentation. Excessive weight gain, like what I said earlier, if you're too big, you're too tight, like, they are rubbing against each other. You notice that that area is darker. Inner thigh gets very, very dark compared to even your armpit here gets very, very dark, like compared to the rest of your body, because that area is not it's not getting enough circulation on your body because your skin are rubbing against each other. Okay. Don't know if I should turn this phone off because there are too many questions coming in. Now, another thing if one of the main things that people don't know is poor diet can cause hyperpigmentation. Poor diet, lack of vitamin B12. If you're deficiency in vitamin B12, you're likely to have like hyperpigmentation. So I advise you to always try as much as you can, either to eat food that contains vitamin B12, fruits, vegetables, or you can just buy it, the likes of folic acid, and just be drinking it once in a while, because lack of poor diet can cause hyperpigmentation, especially vegans. Vegans, because vegans, they don't get enough protein. Well, they do, but most of them, they are prone to hyperpigmentation as well. Okay, now that is that sorted thing. What causes hyperpigmentation? I think I've gone through that. I need to turn this phone off because there's too many questions coming. Now, I'm going to talk about types of hyperpigmentation. So I finished talking about the causes. Now I'm going to talk about the types of hyperpigmentation. So the first one is sunspots. And sunspots are usually very common with people with white skin. I don't know, maybe some of you've seen it, like people with white skin, they have this brown patches. It's more like brown patches. Sometimes dark, it can be a bit dark, or sometimes it can be like a little brown all over their face, their back, upper back, or even their hands here, around here, most times their chest, and then the most common is their face. So they can like develop that sunspots. So sunspot is a type of hyperpigmentation. Okay. Freckles. Freckles is a type of hyperpigmentation. Some people are born with freckles, is like a birthmark, but some people develop it as they age due to over exposing their skin to sun. And what causes sunspot? What causes freckles is actually when you expose your skin to too much sun. It causes you to have that freckles, especially for people with, like I said earlier, white skin. They seem to have that, that common type of hyperpigmentation. Okay. Now, another type of hyperpigmentation is melasma. So melasma, I think I mentioned about it earlier, is due to pregnancy. And this type of hyperpigmentation is usually common on pregnant women. When you're pregnant, you seem to have that, the darkening of face, or darkening of your stomach, or darkening of any area of your body. It depends. I don't know. I didn't actually have any of that when I was pregnant. But some people do. They have their stomach will be darker than the rest of their body, or their face will be darker than the rest of their body. So that is another type of hyperpigmentation. Let's see, what is this person asking? So Acne. Yes, acne is, I think acne is more common. Acne is more common. Well, to darker ethnic groups are more prone to having the acne, that type of hyperpigmentation. Yeah, our skin tone is more prone to that. I've seen a lot of white people too, Asian with acne as well. Yeah, I've seen a lot of. I've seen those there as well. But mostly the what I get from a lot of the treatments that I get, people that I get complain of that are usually people with the darker ethnic groups. They usually have acne, more acne than any other ethnic groups, more hyperpigmentation than any other ethnic groups. Okay. Now, let's see. So the most important now is what are the treatments? What can you do if you notice that you have hyperpigmentation? What can you do to remedy it? One of the things that I want to say is when it comes to skincare, there is not one particular thing that will give you that miracle. Okay. Like one moisturizer is not going to make your skin look so beautiful and glowing all the time. No, it's not going to do that. When it comes to treating anything on yours, if you're not going, like if your acne is severe, I'll probably advise you that that you look for a dermatologist to prescribe something for you to maybe kill the acne, the bacteria that is causing the acne inside first before you now start treating it. Dermatologists sometimes they will prescribe a hydroquinone for you to treat your hyperpigmentation. But their own hydroquinone, it will not be this one they sell in the drugstore. Okay? They will not tell you to go and buy those ones they sell in the drugstore that will bleach your skin in 1 week now. That will get rid of the pigment in 1 week now. But because those ones they will end up, they have very high percentage of hydroquinone. So they will end up burning your skin. So dermatologists will prescribe a good hydroquinone for you that has maybe a lower percentage. And they will tell you the duration of time that you have to take it. Sometimes they will tell you to apply it on your skin, maybe in the night, use it for like 3 weeks or use it for 4 weeks, use it for so time. But after that, after 3 months, discontinue using it because hydroquinone, as much as it can be friendly to hyperpigmentation, it can also be your enemy, especially if you're using it and then you're exposing your skin to outside too much sun. It can even cause your skin to become very, very sensitive and very dry. That is why I don't like hydroquinone that much. Okay. One of the main treatments that I usually recommend, especially for people with acne-prone skin, is vitamin C. Okay. So you can either get vitamin C soap, get the cream, get the serum, get the toner. When you continue using vitamin C for a very long period, it's likely to clear whatever pigment you have on your skin. It's likely to clear it. Regular and longer use, because when it comes to hyperpigmentation, it doesn't just go like that. It doesn't just, all of a sudden it disappears. It doesn't. You have to be consistent and you have to be patient. That is the only way. Okay, Abigail, if I might want to ask a question. Yes, okay, ask a question. I'm listening. Ask a question, please. You can ask any question that you want to ask. Ask any question. Sorry, I'm just seeing your message. I'm more focused on talking about hyperpigmentation. I wasn't even looking. You can ask me anything, okay? Just leave your questions here. I'm ready. This is what this life is about. I'll answer anything. Abigail Ifoma is a YouTuber, right? I have some friends here. I have Lita Staniford. I have Magdalene on Max Forum. You know, a few YouTubers here. Lita Staniford is not she's not a YouTuber, but she can, support you ladies. Magdalene can support you ladies, K Grammon. K Grammon is here. Yeah. Helen. So Helen is here. Helen, are you still here, Helen? What about dark armpit? How do you go about it? Okay, yeah, I'm coming to that. With dark armpits, okay, let me tell you, because I used to have dark armpits, but if not, because this is I don't want to open my... So, dark armpits. Do you exfoliate your armpits? Do you use any... Oh, I think I was like, I know that profile picture, but I was wondering who is that big girl? Because I know that profile picture. I was like, is this outside? So Saito, okay. Yeah. Okay. Aside, Abigail, if I'm please, Magdalene and later, please go support. I think Magdalene is already supporting you. I don't know. Please go and support her. She's a very good YouTuber. She does everything, hey, lifestyle. Please go and support her. And on mass comedy as well. K Grammon. Are you a YouTuber as well, K Grammon? Who else is joining? On mass comedy. Helen, are you here? Are you still here, Helen? Are you still here? All these are my friends. Helen is here. Yeah, these are my friends. Hi, Helen. Yeah, please support Abigail Ifoma, support on mass comedy. K Grammon, are you a YouTuber as well? K Grammon, okay, it's not. Yeah, please support her. She's good. She's my very good friend. Even though we've not seen face to face, but she's always supporting me. In fact, the first live that I did, she was one that told me how to, how to start. I have no idea how to start, how to do anything. She was the one that took me, got me through and all that. So yeah, with the let's go to the question now. With the dark armpits, usually like the most when you're doing like scrubbing your armpits, those I think I did a video. I think the last live that I did, I talked about dry brushing. I talked about dry brushing. Hi Nisha. Nisha is another YouTuber. She's here. Hi Nisha. Thank you so much for joining. Dropping by to show my support. No problem. So Nisha, yeah, so dry brushing is very good when it comes to treating dark armpits. This is what I do when it comes to treating my dark armpit. This is I'm going to tell you now what I did, okay? I was using a lot of I was mixing sugar with honey and a little bit of yogurt. Sometimes I think what I usually do, sometimes in the morning time, I'll just apply yogurt. But I'm not saying it may not be your thing. But if you mix sugar with honey, or sugar with coconut oil, then you can put a little bit of milk in it. and just be rubbing it there, like you like exfoliating that area, because that dark armpit as well, you know, sometimes it's caused by all those deodorant that we use. That is what causes. Oh, still having computer issues trying to solve the. Oh, sorry, love. Sorry. I hope you sort it out soon. I hope you sort it out soon. But one of the main remedy of treating dark armpit is just constant exfoliation. Constant exfoliation. That's what I use. Constant exfoliation will help to get rid of it. Constant exfoliation. And this thing. Do you know licorice? Licorice roots. I did a video on licorice. I think if you go on my channel, you see a video on licorice. I'm actually coming to that, because licorice, when it comes to treating hyperpigmentation, licorice is one of the main ingredients that you should be using. Is natural. Yeah. So you can use licorice. Licorice is very good. It helps to lighten any pigmentation, any hyperpigmentation. Licorice is very, very good in lightening it. Constantly, like I said, it takes time for those dark, especially with people with a darker ethnic group, where it takes a long time before the pigment, fades away. So you have to be patient, but regular use of licorice, regular use of vitamin C, and brushing, scrubbing, exfoliating is because when you exfoliate, you see most of the pigment that you have, some of them are caused by dead skin as well. You see, dead skin, and you see, because that part of that area of our body is not getting enough air, it's not getting enough circulation. So, and then use of those deodorants. I don't use too much deodorant, especially if I'm not going out. If I'm in the house, I don't use deodorant, because those deodorants can really, check. Maybe get if you're buying any deodorant, look for the one that doesn't have any alcohol in it. I can't seem to know one now on top of my head now. But look for the ones that don't have any deodorant. But the main thing, if you want to treat that dark spot, is, can people dance in your life? Of course you can dance. You're free to dance. You're very, very free to dance. Dance anything. You can dance disco. You can dance. What is it at Jamaican? Reggae. You can dance Afrobeat. You can dance. Yes, you can. You're free. Oh, so sorry. Sorry, Nisha. Sorry. So yeah, regular exfoliation will help you. It will help you with that dark under armpits. It will really, really help you. When you keep doing it all the time, you find out that after a while it will start to fade. You even notice it. It will start to fade. And sometimes when you're even brushing there, don't do like a dry brushing. Don't wet the place. Do a dry brushing. 2 or 3 times a week. Dry brushing is very good. Scrub and scrub and scrub. That was what I used on my own. Okay. Now, all these questions that are coming. Let me check. Ah, Lita, you're still here. I thought you've gone. I thought you've gone. Busy. You're like too busy, a workaholic. I thought, you okay? Today is Sunday. Sorry, I forgot. Oh God, my head is so full. I forgot that today is Sunday. Yeah. So let me answer this question that just came in now. Because I left a video on my Instagram and my WhatsApp and my Facebook story. So questions that are coming from Instagram. Questions. Anyway, let me finish first. Let me finish with the treatment, what you can use to to treat hyperpigmentation. So the first thing I mentioned was vitamin C. Regular use of vitamin C can help to, to treat hyperpigmentation. When you're using vitamin C, I probably will advise you to use it at night, because sometimes vitamin C with the sun, they are not very good friends. So you can use it at night; it'll be much better. You can get the vitamin C serum, which is really good. Vitamin C serum is very good. The cream, apply the cream. You can use the cream maybe during the daytime and then use the serum at night. Okay. Then the licorice extract. Licorice extract. You can prepare a mask with it or use it as a scrub. What I usually, whenever I use licorice, sometimes I use it like once or twice a week. I use it as a body scrub. Okay. After scrubbing it all over my body, I use it like I scrub. You need to see me when I'm scrubbing, because I don't like to see any dark patches on my skin. So I scrub and then I just leave it on my body. I just sit in the bath there, browse on my phone. Most times I just read in my, book. I wait for like 20 minutes. I let it sit on my skin for about 20 minutes before I wash it off. Okay, so for those of you suffering from hyperpigmentation, you need to get yourself licorice extract. Sometimes you can get it like the liquid one, or you can get just the root and just blend it by yourself and then mix it. I did a video with that. You can mix it with milk, or you could just mix it with honey and just use it and scrub all over your body. Keep your skin glowing. Don't let your skin get any pigments. It's just sometimes overaccumulation of dead skin cells as well can develop to hyperpigmentation. Another of my good friend that I don't lack. I don't even let it finish before I'll buy another one. Is glycolic acid. And glycolic acid is everywhere. It's everywhere. It's online, in a drugstore. It's everywhere. And it does an amazing job on hyperpigmentation. Okay, it does an amazing job on hyperpigmentation. Glycolic acid, you can get glycolic acid pill. You can get glycolic acid toner. I have like 3 glycolic acid toner here that I use. You can get glycolic acid scrub. Mask, salicylic acid is another one. All the AHAs. The AHAs, alpha hydroxy acid. I did a video on that. It is very, very good when you're treating hyperpigmentation. Glycolic acid is good. The pill, especially if you have the pigment on your face, you can use the pill. But when you're using pill, make sure you use it like once a week. If you're going for those chemical ones, I've never used that chemical one before. Those ones that you remove some layers of your skin, I'll probably not recommend it, especially for darker skin tone. I will not recommend it. You can just use glycolic acid pill that has like 5 to 10, percentage ranges between 5 to 10 or 15. That's the highest you can go. It will do the same job. Well, not the same job as removing some layers out of your skin, but regular use of it is key. You see, like I said earlier, when it comes to skincare, you have to be patient. If you really want to achieve that glowing skin, you need to be patient. You want to fade those pigments on your skin, you need to be patient. Use the right product. It will fade. It's not going to be on your skin forever. It will fade. Even scars. When I was growing up, okay, I had so many scars on my skin because I was constantly falling for no reason. I think someone would just, invisible being would just push me out. I'll just like, I don't know, I'm always falling down. It's like I'll be walking, I'll fall down, and then I'll bruise. And then I had accidents. Actually. I had accident 3 times growing up. I had one with a motorbike. I had one with a motorbike that I had a cut here on my face. I had bruises on my, on my hand here, my elbows. I had bruises on my knee. I broke my two hands. What didn't happen to me growing up? I had so many accidents, but if you look at my skin right now, you can hardly see any pigment because I do a lot of scrubbing. So if I can achieve it, anybody can achieve it. I will, like my mom used to ask God why. Why? What is this? Every time always in the hospital every week. Those doctors and nurses, I used to feel sorry for them because they know me very well. If I go back to that hospital, I don't even know if they recognize because I left Nigeria for the odds of more than 20 years ago. So, but oh my goodness, they know me very well. Oh my goodness. Hi, Nelo's Read TV. Thank you so much for joining. I really appreciate this. Wow. Thank you so much. Oh my God. Nisha, are you still here? Nisha? Yeah, so it wasn't very good. But right now I don't even have any pigment. I don't have anything on my except, the ones that comes out once in a while, that time of the month, which is hormonal. I can't prevent it. But what I was trying to say is when you treat your skin right, your skin will treat you right. When you exfoliate your skin all the time, your skin will surely look good. Okay? So glycolic acid pill, glycolic acid mask, glycolic acid toner is very, very good in treating hyperpigmentation, especially the one on your face. Most times when I mix my natural scrub, do all this natural recipe, if I do the scrub or the mask, as long as it's good on my face, it's good on my body. So I put it all over my body. It works the same way. In as much as the skin on your body is, is the skin on your face is thinner than the skin on your body. But I don't mind. I just put it there. Especially if I did like if I use my licorice to make like a scrub. I scrub all over my body, my face, my lips, everywhere. Because those natural remedies, they do work. I know I'm a skincare specialist. Someone called me the other day and I thought they were going to say something important to me. They were like, you went to beauty school for 2 years and you're on YouTube. I was even thinking that it's a friend of mine. I went to the same school with her. I was even thinking she called me to congratulate me, to say, oh, now you have a YouTube channel. She was like, have you ever seen a beauty therapist, a skincare specialist teaching about natural remedies? I'm like, I teach anything. Oh, thank you so much, Nelo's Read TV. Thank you. I appreciate. Oh, wow. I appreciate you. I really appreciate you. So they're probably against me talking about natural remedies because, some of these companies don't want to tell you the secret of what they do. They are only interested in selling their products. But I talk about natural remedies a lot because they are very affordable. They are very effective. As long as you use it the right way, you don't abuse it. Use it the right way. It works really well. Those licorice, they put it on any lightening creams, any whitening creams. If you just check the ingredient, you see licorice. Even scrub, anything that says it will tone your skin, check the ingredient because I'm very, very particular when it comes to ingredient. Anytime I'm buying product, I check the ingredient. If they don't suit my skin, I drop it. I don't care how much it is, I drop it. Okay. You see licorice extract there. It's always there. Licorice extract. So if you can get the natural one, doesn't have any preservatives, doesn't have any chemical in it, prepare it, mix it with a little thing in your home there. You've come up with your scrub, you've come up with your mask, and there's no difference. They work the same. There's no difference. And because it's natural, some of them will actually work much better. But natural is not for everyone. Some people, natural products are not good for their skin. That is why I usually advise when you buy when you want to prepare any natural product, do like a 24 hours test on the, like a patch test on the back of your hands, and just leave it there 24 hours. And then if you wake up in the morning and you don't see any rashes, you don't see any, any reaction, then it's good. You can go ahead and use it. Okay. So glycolic acid is good. You go get it. You can get the facial toner. You can use, even use the toner, use the peel. Salicylic acid, most of the salicylic acid are usually peel or maybe scrub or mask. Those will really work well with your hyperpigmentation. Please keep your questions coming. Keep your questions coming. Lita, you were supposed to ask me, you said you were going to ask me something before. Somebody, questions are coming here. Later, what of my back acne? Okay, hello Indico's Channel TV, welcome. Thank you so much for joining. Please, if you come, can you give the live a thumbs up, please? Thank you so much. Thank you. So what about my back acne? Okay, back acne is sometimes usually caused by, fungi. A lot of it is, a lot of back acne is a fungi acne. And that is probably going to be another topic for another day. But I will talk a little bit about it. Wow, thank you so much, Nelo. How are you? I came because you shared. Well, thank you, Nelo. Oh, I appreciate this. I really appreciate this help from Nelo's Great TV. So back acne, they usually some of them are very tiny, and mostly from the ones that I've treated, they're very, very painful. So when it comes to those ones that are really painful, I usually advise you go for a blood test to make sure it's not related to any disease or anything. Once it's not related to any disease, because I'm not a medical doctor and I'm not a dermatologist. So I'm a skincare specialist. I treat the ones that I know I can treat. The ones that I know I cannot treat, especially when it comes to prescribing any medication, I refer you to a dermatologist. Okay? So fungal acne is usually caused by, bacteria. And most times, sometimes when you go to the gym to after exercising and you come back home and you don't wash yourself, you don't shower immediately, you leave those sweats to dry on your skin. It's one of the things that causes back acne. When you don't wash your sweat out, immediately you come back, immediately after exercising, you let those sweat dry out on your skin. It causes fungal acne. Fungal acne too can be as a result of hormonal. It's like hormone. A lot of problem we have on our body is caused by hormones. Hormone imbalance as well can cause you fungal acne. And you usually have fungal acne at the back, especially your upper back. So later, if if you've seen a dermatologist and you've done a blood test and it's just your ordinary fungal acne, that's probably has nothing to do with any sickness or disease, the thing that I would tell you to do is first of all, you need to avoid hot water. Okay? Don't bath with hot water, because when you bath with hot water, you're making it worse. It will break up more. Okay? Try not to use any scrub around that area. Try not to scrub it around that area, because if you scrub it, it can irritate your skin more and it can cause inflammation around that area and make the breakup more. So the first thing that you have to do is try and get yourself any sun cream, because sometimes, when you have those pigments, you're going out is making it worse. So try and get yourself sun cream. But the most important thing that you need to be using is non-abrasive exfoliate. Okay, you get yourself non-abrasive exfoliant. When I say non-abrasive exfoliant, I'm talking about nothing that's got to do with scrubbing. So you can get like a mask, maybe a body mask. They sell it, it's everywhere. You can even make one for by yourself. You can even make that licorice, the body mask. I did a video, I have a video on my channel about licorice. So you can use it, any of that. You just try and rub it around that area, but don't scrub it. Just use it as a mask, and you can leave it on like maybe 10 to 15 minutes. Non-abrasive exfoliant is very, very good, because I recommend it to people that have, like, if your acne is just coming out and it's still very new, I advise you not to use any scrub when your acne is still very new and it's still very red and painful. Don't use scrub, because when you're scrubbing it, you're making it worse. You're making your acne worse. Okay? Now, the next thing is the vitamin C. Vitamin C is very, very good for treating that kind of a thing. With Lita, are you listening? Are you still here? So you can get yourself a vitamin C cream. You use vitamin C cream as well around that area. But the most important thing that, thank you so much, Chika. It's weird. Enjoy your program. Oh, thank you so much, Helen, for joining. Please don't forget to support give them some cake. Some of the YouTubers here, give them some cake, okay? Yeah, so the licorice is very good. And then the vitamin C cream, use vitamin C cream around that area. Use vitamin C cream around that area. But most important thing is, I'll probably tell you, if it's fungi acne, I'll probably tell you that it's better to kill the fungi first. So you need prescription drug to kill the fungi from the inside, because it's infected. So you have to kill it from the inside. So as you're drinking the medication, and maybe get prescription cream as well from a dermatologist to be using, and then with the micro exfoliant, it will go. Okay, later. But when you come back from the gym, you need to wash yourself. Don't let the sweat dry out on your skin. Try and wash yourself as soon as you can. Don't let the sweat dry, because those are the things that causes a lot of that. Weight gain as well. Weight gain can cause you to have that back acne. Call it back acne. So weight gain, it can cause you to develop that. Okay. Now, some questions here, they're coming from Facebook here, and I'm gonna answer. I'm just gonna answer like 3 of them here. Okay, this one says, "Hi Chikelly Beauty. Since I had my 3rd baby, my face is darker than the rest of my body. Please, I need your help." Okay. I said this earlier before, that one of the causes of hyperpigmentation is hormonal as well. And when it comes to pregnancy, we call it melasma. Melasma is the kind of hyperpigmentation that you get when you're pregnant. Okay? And sometimes if you're pregnant, I don't know this person, I don't know if you're from your name, I don't know if you're from dark ethnic group or white. Okay, no, that seems a bit like Spanish name. So when you're pregnant, this pigment called melasma is when you have this darkening on some area of your skin. It can be on your face, or sometimes it can be on your stomach. And Melasma is the pigment that you get when you're pregnant, and it's caused by its hormonal. Sometimes after pregnancy, it can just go on its own. Your skin will get lighter. Most people will actually get it too on their neck, face and neck. Most women, it's usually common in women anyway, they'll get it on their face and their neck. Most people will get it on their stomach. Okay? After pregnancy, some people it will go. Sometimes it doesn't go. So with the use of these things that I mentioned, with the use of vitamin C serum, cream, licorice, and glycolic acid, it's the three main. There are other things that you can use to treat hyperpigmentation, but these three that I mentioned is with the other one that is coming as well. I'm going to mention the last one. They are simple. They are things that you can easily get. They are the three that you can easily get. And the ones that I know that are safer. Because I know other ones that I can mention, but those ones you may end up like, having your skin dry, or if you use it for a very long time, because hydroquinone is good as well. But hydroquinone, you need to be prescribed by a dermatologist before you can use it, because they know the right percentage they will prescribe for you. They know the right percentage to give you. Because what they're going to prescribe for you will be different from those ones you get in the drugs or those tube creams that can cause you skin cancer. You don't want those ones. You want hydroquinone that are the prescribed hydroquinone. That is probably what I would advise for someone that have melasma. Maybe you can use that, but make sure you meet a dermatologist. Vitamin C will really help you. Vitamin C cream serum, glycolic acid will help you, and that licorice extract will help you to treat melasma. Okay, because melasma is a hyperpigmentation that doesn't after pregnancy, after you've had your baby, it doesn't stay for a very long time. With regular use of all these ingredients, it will go. Regular use of all these skincare products, after a while it will go, because your hormone will now get back to normal after you've had your baby, and your skin will go back to normal. Okay, some people are lucky, just it goes on its own. Some people are not. So this lady is probably one of the unlucky ones. Okay, so the person that asked this question, I can't see your name here, so you're probably not here. Maybe you're gonna watch the live later. Okay. So the second one is, hi Chikelly Beauty, I have stretch mark all over my thighs. Please, what can I use to remedy it? Because I can't even wear short dress. Okay, I'm talking about today is about today is about hyperpigmentation. Stretch mark will be a different topic, because stretch mark has nothing to do with hyperpigmentation. Stretch mark is another pigment on its own. Stretch mark is usually caused by when your skin overstretched itself, especially if you put on too much weight. Like your weight gain increases so fast, you can develop stretch mark. Sometimes maybe cream, if you're using all these bleaching creams, they will tamper with the melanin on your skin, and then it can result you to have stretch mark. But today is not really the stretch mark. Today is not about stretch mark. I have to share this. Thanks a lot for selflessly helping me. Oh wow, massful. Thank you so much. I'm happy to hear that. Thank you. Yeah. So, but I have a video on my channel about stretch mark. So whoever asked this question, if you can watch that video, I've received a lot of private messages, feedbacks about those recipes, and that they are working. If anybody tells you that you will get rid of stretch mark immediately, no. Get rid of stretch mark in 2 weeks. Get rid of stretch marks in 3 weeks. No. No, 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 no. Even on that video, I said it. It doesn't work like that. When it comes to stretch mark, you have to be very, very patient. But when you use the right product, it does actually go. because I am a living witness. When I had my second baby, I had these awful, awful stretch marks on my thighs. I did a lot of things. There is this particular cream. In fact, I'm going to give a review of that cream this month, before the end of this month. I'm going to give a review of that cream. And that company is probably not going to like me, but I will say the truth. That cream is so expensive, but it doesn't work. When it comes to stretch mark, it's zero. Because I used it. It doesn't work. It does nothing. It did nothing for me. It did absolutely nothing for me, for my stretch mark. Nothing. But it seems to, have this huge, name that it helps you get rid of stretch mark. But it didn't work for me. So whoever has this question, go and watch my video of how I got rid of the toughest stretch mark. And those pictures that you actually, that's on my thumbnail there, those pictures that you're going to see on that video, those are my thighs. The before and after picture, those are my thighs. So you watch it. Those remedies, they work. And it took me time before it took me time to get those remedies. I did a lot of experiments. I tried so many products before I now came into, I formulated those recipes by myself, and it did work for me. I have no stretch mark on my thighs now. They're gone. They're gone. They're not there. Maybe just a little, but not much. You can hardly see it. But those bad ones, they're just gone. So it took a while, but it did go. It did go. So with stretch mark, is all about scrubbing, getting that area very hydrated. You understand? Because with stretch mark and cellulite, that area of your body is very dry. So the secret is getting it hydrated. Moisturize, moisturize, moisturize. But moisturize with very thick creams, oil. Those oil, they did it for me. And I was massaging my thighs every single day for at least about 30 minutes. I will massage in the morning, I will massage in the evening with those oils. And before I use the oil, I will try and heat it, make it a little bit hot, because I need to improve circulation. I need to boost oxygen production around that area. That was what helped me with my stretch mark. Dry body brushing. Dry body brushing was another very beautiful remedy that helped me with my stretch mark. I was doing dry body brushing at least 2 times a week, constantly brushing that, because you need to improve circulation there. Stretch mark and cellulite that's the secret of keeping them away. Try and improve circulation in that area. When you're massaging there, try and use a friction movement. A friction movement to heat that area up. You massage it very, very strong, very, 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 very fast friction movement. And when you finish, you see that area very red. It does work. Those remedies work. So you use it, and after a while, you start to notice. There's another question here. Okay, so let me just go through them and pick what I want to answer. Okay, pick what I want to answer. Because it's too many of them. Hi, Chikelly Beauty. I have acne all over my face. I've tried so many things. It comes out almost every time, and I've used so many things. I've spent so much money, but it's still not going away. Okay. So this person has acne all over her face. She has used almost everything. but the acne doesn't seem to go away. Okay. The mistake that people do is when they have acne, they will like keep popping and popping it all the time. They'll pop and they use their hand, or pop. No. If you're not a professional, don't pop your acne. Don't even touch it. Don't touch it if you're not a professional. Because what happens is when you try to pop your acne the wrong way, you're doing it the wrong way, and that is actually what can cause that area to darken, because you're pushing it in. You're not even popping it out, you're pushing it inside. Those bacteria in, and your hands, you don't know where your hand has touched. You don't know where your hand has touched. You don't know the amount of bacteria you have in your hand, and you're putting your hand on that acne, and you're causing it to be more infected. And when the acne goes, you see that you have those very, very dark pigments on your skin. Those are one of the main causes of those darkening of your face after your acne must have gone, because you're using your hand to pop it. That's not good. But a lot of things that I've noticed about acne, people with acne, is some of them, especially people with oily skin, okay, they will tell you, oh, I don't, when you ask them, what are you using on your face? They will tell you, I don't use anything because I have oil on my face. My face is too oily. When you have oily skin, that is when you need that cream. That is when you need to apply cream. That is when you need to exfoliate your skin, because you're producing too much oil. So when you don't apply moisturizer on your face, your skin is fighting each other, because your skin needs hydration, and you're not putting any moisturizer on your face. So your skin, it kind of retaliates by producing much oil, because it needs to hydrate itself, and you end up breaking out. So in terms of the acne thing, I probably would have loved to know what your skincare routine is. What do you do to your skin? What are you using? Because sometimes if you're using the wrong product on your skin as well, it can cause you to have acne, because the acne, according to you, is constantly coming out. No matter what you use, it's coming out. Have you visited a specialist, a dermatologist, to have like a blood test to know if the acne is like hormonal? Because you need to know that is the acne hormonal, or is it just, if it's not hormonal, then that means probably using the wrong product, and maybe your diet is not good. Maybe you're not eating the right thing. Because a lot of the things what you eat, put inside, is what comes out on your skin. If you're not eating the right type of food, it's not going to your skin is not going to bounce back right. It's not going to look nice if you're not eating the right products. How do you detox your skin? Because when your liver accumulates a lot of toxins, you're eating every time. You're eating morning, afternoon. Some people eat like 5-6 times a day. And your liver is what is processing all those food that you're eating to allow you to, pass the, feces out. And sometimes your liver is not able to, process all that thing you're eating. So a lot of them are then stored in there. So you need to detox. Once in a while, you need to detox your skin. On Mass Comedy Forum here, she's a good YouTuber. She does a lot of healthy recipes. I have some on my channel as well that you can be drinking, because at least once a week, you need to detox your skin. Drink those. Just say to yourself, okay, today I'm not going to eat any food. I'm just going to drink all those smoothies, just those fruit and vegetable smoothie, just to detox my system. Because when you don't detox your system, it can react on your skin by causing acne breakouts. Okay, the person that asked this question, I want to give you an assignment. Okay, I want to give you an assignment. Maybe you can send me you can me and you, maybe you can chat privately. But I'm going to give you like a routine of what you should do when it comes to your skin, and when it comes to the some recipes that you can use to detox your skin. After 3 months, I need to see your skin before and after. You will see a huge change on your skin. Because if the acne is constantly coming out, if it's not hormonal, I don't know if you've been to dermatologists, you've done a test and it's not hormonal, then it's either your diet is not good. It's either you're not eating the right food, you're not detoxing your system, and maybe you're using the wrong product for your skin type. That is another enemy. Using the wrong product for your skin type can cause you breakout. It doesn't matter how expensive that product is. I don't even spend too much money on skincare products. See all those high and mighty skincare products that are costing like hundreds and hundreds. I don't. Because I believe on a regular skincare routine, if you eat well, your skin will look nice. Okay, so you send me a message. I want to know what you're using. I want to know what your skincare routine is before I'll now tell you what and what to do. And the acne will go. It will go. But if it's got to do with hormone imbalance, if it's got to do with any disease, because sometimes when you have like kidney disease, chronic kidney disease, it can result to you having hyperpigmentation as well. Even diabetes can result to you having hyperpigmentation. So if it's not got to do with any of those medical things, because like I said, I'm not a medical doctor, then it's treatable. Okay. Other question is here now. Questions. Too many of them. Okay. I'm getting a lot of questions here about stretch marks. Getting a lot of questions here about stretch marks from my Instagram. These people asking me all these questions. You didn't even join my life. You're sending all your questions. Getting a lot of questions here about stretch marks. I have a video on stretch mark on my channel, please. So if you're watching a replay of this, I keep looking this way and the camera is this way. If you're watching a replay of this, I have a video on my channel about stretch marks. So if you've asked me questions, if you've sent me question about stretch mark, because I have close to 10 questions here about stretch mark, I cannot answer all of them. That video will answer everything you need to know. But if you're still not satisfied with the video and the recipes in that video, you can send me message privately. Okay? Because it's just like so many questions here about stretch mark. Okay. Hi, Chikelly Beauty. My face has always been very darker than the rest of my body. And someone told me that I can use something to lighten my skin to make it even. Okay, so this person her face is darker than the rest of her body, and she's looking for something to lighten her face. I think I've talked about it when it comes to lightening your skin, the natural way, not the bleaching. When it comes to lightening your skin the natural way, that your face is darker than the rest of your body, that is hyperpigmentation. And I know that you're probably from darker ethnic. Let me see your name here. Questions. Yeah, your name. Yeah, you have a darker skin tone. So when your face is darker than the rest of your body, that is hyperpigmentation, and it's probably because from sun exposure sun exposure. So you need to get yourself a sunscreen. If you're buying any moisturizer also, you can get moisturizer that contains SPF. Protect your skin from the sun, please. It's very, very important. It doesn't matter if you're dark skin tone, it doesn't matter if you're fair skin tone, you should always protect your skin from the sun. Try and get moisturizers that has SPF on it. Please try and do that, because sun exposure is one of the causes, like one of the causes of hyperpigmentation, one of the causes of premature aging. Sun is good on your skin in the morning time before 10 o'clock. You need that vitamin D, you know. But after that, the rest of the sun is not your friend. That is when protecting your skin is very vital. Okay. So I've mentioned some skincare products that you can use. For the person that asked this question, I've mentioned some skincare products that you can use that can help you to achieve even skin tone. But the most important thing is you need to always exfoliate your skin. Exfoliation is very important when it comes to treating hyperpigmentation. Exfoliation is very, very important. So you need to constantly exfoliate your skin, moisturize your skin, but most importantly, protect your skin from over sun exposure. Okay? Now, let's see the next question. Next question. Yeah. Okay. My sister has that problem. Oh, okay. Your sister has the same problem. Her face is darker than the rest of her body. So this person says, "Hi Chikelly Beauty. I have dark under eye and I've used a lot of creams, but it hasn't cleared the problem. Please, what can I do to reduce it?" Okay, dark circles. You have dark circles under your eyes, dark circles. Dark circles is probably, I think I talked about it on my one of my videos, is it? Or the last live that I did. So there are two things that causes few things, but two of the main things are like if um, sun. That's another thing that causes, because the skin around here. When someone is aging, you usually notice it from under their eyes. It will get really, really thin. The skin elasticity around this area will like drop, and you start to notice your eyes will get puffy. The muscles here, as you're aging, the muscles around your eyes get very, 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 um, you know, not as strong as it used to be. So it starts to loosen. The skin around there starts to loosen because the muscles are like weak because you're aging. So the muscles that holds that skin there begins to get weaker. So in the process, you can develop puffy eyes, most times dark circles as well. So the thing is, you see, when you do that, when you end up having that, try and get yourself sunscreen. Get yourself a sunglasses with 100% UV protection. Try and get eye cream. Vitamin C eye cream is very, very good for treating that area. Do a lot of massaging. Do a lot of massaging. I think I had a video one time. Do a lot of massaging. Okay. With you can use like vitamin A capsule. Vitamin A capsule is another remedy. I forgot to say it actually. It's another remedy for treating hyperpigmentation, especially stretch marks. Vitamin A capsule, vitamin A oil is very, very good when it comes to treating hyperpigmentation. So you can get the capsule, you pop it open, you can use it like that, but be very careful if you have very oily skin because you know it's very thick. So if you have oily skin, don't leave it on your skin for too long. But vitamin A capsule is very good. You just apply it around that area. So for somebody with dark circles, hi Chinwe's family, welcome. Welcome, welcome, welcome. Thank you so much for joining. I appreciate you. Thank you. That's your journey. Can you please give this live a thumbs up, please? Thank you so much. So light dark circles vitamin A capsule is very good. You just pop it open and then rub it around that area. Rub it around that area, and you can leave it on for about 15, 20 minutes, 30 minutes, and then you clean it off. And then you can put your serum. Aloe Vera Gel is very, very good to treat under dark circle, under eye dark circle. Aloe Vera Gel is very, very good. The 100% natural one. You can get the leaf, and what you do is just apply it there, around there. Cucumber juice. Cucumber juice is good. Like if you mix it up, you let it cool down a little bit, maybe from the fridge, and you just apply it. Oh, thank you so much. Thank you. You just apply it there. Okay? It will really help to treat that dark circle. But get yourself vitamin A eye cream, be using it. But vitamin A capsule is very good for treating it. Whoever has this question, you can do that. Okay? Financial therapist. Hello, Ma. Hello, financial therapist by Magdala. Thank you so much for joining. I appreciate you. Please give this live a thumbs up when you join, please. Thank you so much. So dark circles, that is treated now. The next question. Oh my God. Yes, you finally made it. Finally made it. Thank you so much. So financial therapist is she's a very, very new YouTuber. She's a newbie, and she'll be talking about when it comes to finance, the psychological part of finance. It's the psychological part of finance. So please, I need you to support her. She's just a new YouTuber. I don't even know if there's a video on her channel yet, but she's going to put a video up there soon. Please, you support her. Please, please, please. Anything that is going to do finance, the psychological part, she's good. I can attest to that. She is good. She's a specialist when it comes to managing your finance. She's a specialist. So please, she needs your support. Okay? Now, yeah, video will be up soon. Yeah, video will be up soon. I'm excited. I can't wait. I can't wait, honestly. I really can't wait. Yeah, so that's it. That's the dark circles. And then this person wants to know. Another stretch mark. Okay. I'm getting a lot of questions about stretch mark here. Maybe I should do a live on stretch mark because the amount of questions that I'm getting here. Where is my charger? The amount of questions that I'm getting about stretch mark. Too many. I think my next live may be treating stretch mark. How to treat stretch mark. What causes stretch mark or something. Because this topic that I'm doing here is because I got so many questions about hyperpigmentation. So I was like, well, okay, let me just do a video about it. Let me just do a video about it since a lot of people wants to know, have that issue. So, Yeah. So yeah. So I think I'll do another live on. So financial therapist by Magdalene. When is your video coming up? When is your video coming up? Because I need to tell them so they will know. So Magdalene is who said, please do. Oh, I should do the live on Stretch Mark. Yeah, I think I'll do that. Oh wow, so it's uploading. That's good. Please support her channel, financial therapist. So tomorrow, okay, that's good. That's fantastic. Okay. Yeah, yeah. So Magdalene is who said I should do a video on stretch mark. Oh, that's good. I'm gonna do that then, because I have so many questions here about stretch mark. There's the same thing that happened before I did the hyperpigmentation. I was getting so many questions. So I hope I covered the area that I know, the things that I know that are necessary. The beauty part I covered. The hyperpigmentation that I covered today is the beauty part, not the medical part. So the medical part, you probably need to go and see a dermatologist to do that. Okay, so I have another question. Do you know people have not have any question to ask me? Nothing to ask me, no? You have any question? Please the stretch mark. Okay. 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 I will do a video on that. So I'm looking at there's a lot of questions here. There's a lot of questions here. Oh, okay. Okay. I want to know about white hairs and blackhead. Okay, so white hairs are like a form of acne. You know when those acne like they are still coming out. You know when they are new, they are coming out, and you could see the tip. Maybe you could see that whitish thing on the mouth there, and the tip of the acne there. That is what the whitehead is. And then the blackhead is when the acne has already formed, and after the acne is gone, you get those black spots. That is a difference. They are all both of them are all acne, but it's the difference is when the acne is still coming out. That is when like you call it the white acne, the white head, and then when the acne has already formed, and you ended up developing blackheads. It's like pimple. Okay. Okay. So blackheads are more like pimples. Yeah, that's what they are. Because what actually causes blackhead is, when you have when you have when you're producing too much oil on your skin. Okay, you produce too much oil on your skin, and those sebum, they get infected by bacteria, because the pores, they are clogged, because especially if you're not exfoliating your skin, so those pores, they get clogged up, and then the bacteria forms inside, and then the acne comes out. It turns to acne, which is painful. Okay, so that is what that is what blackhead is. It's the form of clogged pore that changed to acne and then formed that pimple on your face. Well, this question. Okay. So both of them are acne basically. Both of them are acne basically. But I think blackhead sometimes, sorry, whitehead sometimes. Uh, Most of them may end up not becoming full acne. They may just be on your skin there because sometimes you could say that like those little spots on your skin there. But the blackhead, like they're full blown pimple. They're full blown pimple, and they are usually infected by bacteria. Usually bacterial inside. Okay. Do you have any of that? So if you have any of that, you can use like a chemical exfoliant to treat it. You can use a chemical exfoliant to treat it. You can use a pill or a mask to treat it because once it turns blackhead, then that's pigment. Then it takes a while get to get rid of it. Okay, and from your skin. Now, do you have it, financial therapist? Do you have blackhead? You asking? Most of the acne that we have to can be inflamed hair follicles. Like sometimes when you shave your skin, when you shave the hair on your skin the wrong way, if you shave it like against the hair growth, it can end up being like all those ingrown hair, and you may end up having those black spots all over your skin. And a lot of people have that. Oh wow. Oh wow, I have that on my chest. You have the black head or the white head on your. Oh, okay, you have the white heads. Yeah, try scrubbing it. Try scrub. What is your skincare? What is your skincare routine like? Do you exfoliate your skin? If you use chemical exfoliant, it will get rid of it. Chemical exfoliant to get rid of it. Use chemical exfoliant to remove it. It will get rid of. If you use it, constantly, it will go. I have that on my chest. So Magdalene is what do you have? You have the white head or you have the black heads? The white heads or black heads? Which of them do you have? I have. Okay, let me answer this question before Magdalene comes up with her own question. Okay, so this person, oh, another stretch mark. Okay. So this person said, "Hi, Chikelly BT. I had an accident years ago where I bruised my knee. And it's still dark." Okay, so yeah, injury is another form of hyperpigmentation. So this person says she bruised her knee when she had an accident. She bruised her knee, and she's looking for something to help with scrubbing, 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 brushing, dry body brushing. It will help. Even though sometimes when you look at my knee now, see, there's not no see, there's nothing like you know there's no dark. I don't have any dark knee because I see a lot of people. They have this dark patch on their knee. and most of them are either like dead skin. Most of them is dead skin. So keep scrubbing and keep brushing it off. Brushing dry. Use those brittle brush and be brushing it. It will go. And scrub and moisturize your skin as well. Moisturize your skin. Look for a good moisturizer. Constantly moisturize your skin. It will go. Okay. Okay, so you have blackheads. You have blackheads on your chest. Okay. Right. Yeah. So if you have blackheads on your chest, you just need to scrub your body. You just need to scrub your body. Those are probably those tiny acne that they were there, and then once they go, they form those blackheads there. Do you scrub your skin, Magdalene? Magdalene, do you scrub your skin? Because if you scrub your skin, you're not supposed to have all that on your skin. You're not supposed to have all those blackheads. If I see someone that doesn't scrub their skin, I usually know it looks dull. Not really. I was right. Okay. You need to scrub your skin. Scrub your skin. It will go. And if you have oily skin, try and be bathing at least 2 times a day. No matter how tired you are, at least cleanse. Sometimes when you don't cleanse your skin very well, too, it can cause your skin to break out if you don't do a very good cleansing. So try and be cleansing your skin. Sometimes when I'm using facial cleanser, I use it as well on my, got this place in Beauty Times Your Day clothes. So I use it around here, my chest area. If I'm using any mask, any scrub, any mask, when I'm applying mask, I start from here, apply it upwards. So try and scrub. And Maggie, try and scrub. Maggie, do you scrub? Do you scrub your skin? Lita Stanifort. I don't scrub my skin, only my face. Yeah, a lot of people do that. They think there is only their face that needs scrubbing. Their body doesn't need scrubbing. You need to scrub your body. Scrub everywhere. Even your back. Get those long brittle brush and scrub your back. Ah, oh God, my financial therapist said no. So 3 of you don't scrub your body. Okay, you need to start scrubbing. When you scrub, those white hairs and black hairs will go. Give it like 3 months, it will go. But the white hairs shouldn't take that long time. Some of my videos have very good recipes for treating hyperpigmentation. Motani methi, there's licorice, there's sandalwood, there's sugar scrub. I have so many of them for treating that. I dream to be a diva like you to take care of my skin. Don't dream. Don't dream. Practice. Practice. You need to practice. You're watching my video and you're not practicing, you're not using. I have a lady from Zambia. She joined my YouTube. She had a problem with her face. And she was using one of my the recipes on my video, the way I talk about how to treat hyperpigmentation about bleaching and all that. And she was using my recipe. The recipe that I had on that video, she was using it. And she sent me a picture of her face. I wish she would let me, use that picture to like advertise. I think I put it on my status for a day. Because I didn't want, in case she's like, she's a private person. But the changes on her face, even me that that had those recipes, I was shocked to see the changes that she had on her face. I couldn't believe the transformation that she had on her face, because her face was very, very dark. It was damaged from bleaching cream. Because when you use bleaching cream, it depends on the kind of bleaching cream that you use. Some of them will give you a 4-degree burn, because when you bleach your skin, you're kind of removing the layers of your skin. You're removing layers of your skin. So you're damaging your skin tissue. That is why you end up having a very strong hyperpigmentation, those darkening of some areas of your skin and your face. But her own was really, really bad. And I couldn't believe the transformation when she sent me that picture. I didn't know she was the one. Initially, I was like, who is this person? If not because I had her, if not because I had her contact on my phone, I was shocked to see the transformation. So, taking care of your skin, the reason why I'm saying this is when you take care of your skin, it does give you that result that you want. It does. So she was using my recipe because I did a skin consultation with her. I told her what to use and what not to use, and she followed my advice, and she's happy now. This is someone that she would never go out of her house without makeup. She goes out now. This is, it's an ongoing process, but I know by the end of this year, that lady is going to have the most beautiful skin ever. Because because I like when I'm working, I do a lot of skin consultation. I like when I'm working with someone, they are serious. They are doing the things that I ask them to do. There's this other lady, oh my goodness. I don't even know where to start. I'll tell her to buy this one, to go and buy another one. I don't even want to do that now because client confidential anyway. But yeah, when you treat your skin the right way, it will surely, give you a good report. Okay, so with blackhead and whitehead, it's not something that is untreatable. It's very, very treatable. It just needs you to use the right product and to be patient. So Megan, Michael, what say selfless giving out all this information. Let's okay. Thank you. Thank you so much. Yeah, I know. I know. Yeah, I give skin consultation to where I charge. But these are for my viewers. At least they take their time to come and watch this live with me. It's not easy. It's not easy to do it. So any information, I like to see people looking good. Sorry for the men, but women I love to, because we do a lot of too many things. We're not mothers. We're this, we are that. We don't even have time for ourselves. So any little time, any little opportunity, self-care is very important. So I preach a lot of that. And my own part of self-care is skincare. Because a lot of women, they put their husband first, they put their children first before they will not come last. It shouldn't be that way. I'm not saying you shouldn't take care of your husband or take care of your kids or take care of your boyfriend or be a single mother, because single mothers is usually difficult as well. But at least once a week, take out time to look after yourself. Take out time for yourself. Okay? I'm going to answer a few more questions here from, wow. Magdalena. Okay, fine. I'm gonna take it seriously from now on. I'll be the next testimony. When did you tell me that? I think I've had that statement before from you. You're too busy. Yeah, please do. Please do. Please do. I know that darker skin tone, most times you think, okay, you don't need to, look after it. But you actually do, because if you don't do that, it will catch up with you. It will catch up with you. So, okay, the next question, Chikelly. Hi, Chikelly Beauty. I have, okay. And yeah. So this person is the same thing, talking about acne. Okay. Okay. So had acne for 3 years. Okay. So even you've met even use prescription drugs, still nothing. And you're tired of taking prescription drugs. Okay, so this person had started having acne, you know, since their early 40s. That's 3 years now. It's been 3 years now. So yeah, you know, hyperpigmentation too. I said it earlier. Aging, as you're aging, it can you can start having hyperpigmentation, especially people that have darker ethnic group. As you're aging, you start developing, especially in your 40s, you start developing hyperpigmentation. So this is something that you don't used to have. All of a sudden, you start having that. Some of them can be hormonal. Some of them can be hormonal. But this person says that, you know, hi Andre Harris. Hey, welcome to my live streaming. I'm happy to have you here. I appreciate your support. Thank you so much. Okay, I use turmeric with butter with honey, lemon, ground flour, and olive oil. It makes your skin look amazing. Well, there you go. And all these things that's mentioned here, they are all natural products. See what I was saying about using natural products, that they are good for your skin. Turmeric. I said it on my last live video. Um, when I was talking about skincare routine, I talked about turmeric. Turmeric, oh, is very, very good for treating hyperpigmentation, because this is a life I cannot cover everything. But I have a lot of videos. I've done a video on how to use turmeric. Even my video that I did about bleaching, how to treat skin damage by bleaching. I used turmeric on that. Turmeric was one of the recipes that I mentioned on that video. Turmeric with butter, milk, honey, ground flour, and olive oil. So can I ask you, Andre Harry, do you mix all this in one recipe? You mix all this in one recipe, is it? Turmeric with butter, milk, honey, lemon, ground flour. It seems like a lot of things for one recipe. Do you mix all of them, or you use turmeric with honey or turmeric with lemon? So with lemon is good, but I won't recommend it for someone with dry skin. And if you're using lemon, be very careful, because it contains citric acid as well, especially with sun. Can react with the sun. But yeah, if it works for you, because natural products, what works for Tom may not work for Dick. So you need to be very, very careful when it comes to natural product. Make sure, like I said, you do a patch test on the palm of your hand for like 24 hours. And if you're not reacting to it, then you can use it. Okay? So this particular recipe works for this person, which is okay. It's good. So Andre Harris, do you use all these ingredients that you mentioned here? Do you use it all in one recipe, or you mix it like differently? And what are you using it to treat? Hyperpigmentation or what? Okay, that person is not saying anything. Let me answer one more question that just came right now. There's a lot of questions here on stretch mark. Wow. I may have to do that next week. Stretch mark. A lot of people want me to talk about stretch mark, but I have a video on stretch mark. I have a video on stretch mark. I have a video on stretch mark. So I don't have stretch marks, but I have cellulite. Yeah, stretch mark and cellulite. You know, cellulite is fatty tissue. So it's sort of like when you have a lot of fatty tissue on some area of your body. It's usually around your thigh area that most people have stretch marks. So cellulite. So with cellulite, I said it earlier. You have to do a lot of body brushing, a lot of scrubbing, and moisturizer, massage with cellulite. Keep massaging, keep massaging, and keep massaging. Hydrate that area. Keep that area rehydrated. Keep the circulation going, and in turn, the cellulite is going to reduce the appearance. Is accumulation of fatty tissue. That is what is causing your body to have that cellulite. So, little Stanifort, you told me earlier that you don't use body scrub, which is one of the things that will help to reduce that cellulite. Body scrub is very, very good in treating cellulite. Okay, sugar scrub, coffee scrub. Coffee is a very good exfoliant. Coffee helps to reduce any pigments on your skin. So I did a video last time too with coffee and cocoa, and that body mask is very, very good when it comes to hydrating your skin. You know, niacinamide is a very good ingredient. Vitamin B3. So use any product you're buying, make sure it has niacinamide because it's a very good skin hydrating agent. It's very, very good for treating cellulite. Okay, so maybe any body lotion that has that ingredient will be very, very good for your skin. But a lot of body brushing, a lot of scrubbing, a lot of moisturizing your skin. Moisturizer is like giving your skin food. When you don't moisturize your skin, you're starving your skin of food. Okay, you're starving your skin of food. So you need to always moisturize your skin, especially before you go to bed, when your skin has overworked itself. Our skin go through a lot of, process during the daytime. It's like you're doing everything, you're working, the sun, the pollution, the environment, even live in harsh environment, which affects your skin and even can cause you hyperpigmentation as well if you live on a harsh environment, cause you hyperpigmentation. And then when you come back at night, you're sleeping, your skin starts to repair itself, losing all the dead skin and dead skin cells start regenerating itself. So a skincare product seems to work much better. Skincare product used to work much better at night. That reminds me, I just uploaded a new video about steaming your face. Steaming your face. I was talking about hyperpigmentation. I had not even mentioned steaming. Look at me. Yeah, steaming your face. It helps to get rid of toxins, those toxins that are in your skin. Steaming your face helps to get rid of that. Try it. Try steaming your face once a week for 1 month. Try it. Okay? So the video that I did is just the ordinary steaming. But when you want to steam for deep cleansing, is when you're steaming and you're using facial scrub together, you steam a little bit, you bring your face out and you scrub, and then you put your face back again, because all those dead skin that are losing, all those pores, they're like all those clogged pores, they are all losing, and when you're scrubbing and you're steaming, helps to, it takes them out very easily. So steaming your face, it kills bacteria as well. It helps to keep bacteria on your skin. Those heat helps your skincare product to work much better when you steam your face, because all the pores are open. So when you apply any cream, then any scrub, any mask, it helps to penetrate a little bit deeper to your skin, and then the product will work much better. That is one of the advantages of skin steaming, because the temperature of your skin has increased then. Okay, that was why I talked about body brushing, because when you do the dry body brushing, you increase the temperature of your skin, because as you finish, you could actually see the whole of your skin will turn red. It's not the bad part of red where you have the sunburn, no, because you have improved oxygen. You boost oxygen production around there by body brushing. So any product you put after that on your skin works perfect. Works perfect. Okay. I'm just gonna answer 2 more questions here, and then does anybody have any more questions to ask me before I call it? So let me answer this one here. Answer this one here. Okay. Now, so this person has dark knee. Has dark knee. Yeah, it's the same thing I've been talking about. Dark knee, dark knee, dark knee. Not acne, dark knee. It's my accent. Dark knee. So she has dark knee. Her knee is very dark. Keep scrubbing it. I said it before. Keep scrubbing it. Keep moisturizing it. It's like repeating myself. Probably because the person is not here anyway. So yeah, keep scrubbing it. It will clear. It will clear. Okay. Keep scrubbing. Now, okay. So keep scrubbing. It will go. I use turmeric. I'm still looking at this recipe. This person says here, use turmeric with butter, milk, honey, lemon, ground flour. Seems like a lot of recipe in one. And butter with milk, honey, lemon. Nah, I don't like this recipe at all. I don't like all the recipe in one. Yeah. So I'll probably say, if you're watching my live, I'll probably say no, don't use this. Turmeric with milk is fine. And then you add honey and lemon and ground flour and olive oil on top of it. Yeah, that's a lot of the ground flour. Well, flour is good, but I don't know about adding it with turmeric together. Olive oil. This would actually be like 3 recipes in one. You can use honey and lemon and treat hyperpigmentation. Use turmeric with milk. You can use ground flour with maybe milk and yogurt. So olive oil is good for it. It's full of antioxidants. So it's very good for stretch marks and for someone that is, that want to glow their skin. Olive oil is very good. Let me answer this question here now. So Acne, I've answered that one. Hi Chikelly Beauty. I have lots of scratches on my face and I stand up this. Okay, this person has loads of scratches. I don't even know what caused the scratch. So according to this person, the scratch is like really, really dark and they are finding way to treat it. Okay. It's the same thing. Injury can be form of hyperpigmentation as well. Injury is sustained injury. I even use myself as an example in the beginning of how many injuries I sustained when I was growing up. It's all about taking care of your skin. It's all about exfoliating your skin. All those scratch they will go. So I don't even know what your skincare routine is, so I'll know where to start. And this person is not here now. So if you ask me this question and you're watching a replay of this, like, can you please send me, or maybe it's okay, I'll reply. I'll reply privately because I need. This is the kind of people I do skin consultation with because I need to know what to tell you, what to use. I need to know what your skincare routine is. I can't just sit here and say use this or use that. And the scratches is on your face. Okay. I Chikelly Beauty. After my last baby, I have developed a lot of darkening of my neck and my face. Okay. This English is not very good. This person is definitely not an English speaking from an English speaking country. Because okay, according to this message, let me try and understand it. This person has this person after their last baby, their neck has become dark and their face. Okay, it's the same hyperpigmentation. It's the same thing I've been saying. You should do everything that I've mentioned here to treat hyperpigmentation. If there is any other thing that you want specification on, you want clarification on, you can send me a private message. I do a skin consultation with you, so that I will know first of all what your skin type is. I will know when you start having those breakouts or those hyperpigmentation, what caused it. When you do start noticing it, what kind of product are you using, and what have you done since then? What product are you using right now? It's like step by step of what we need to do before I will even tell you, okay, do this or do that. Okay, so this life, I'm just talking about hyperpigmentation, what causes hyperpigmentation, signs of hyperpigmentation, and few remedies of how to treat hyperpigmentation. If you need any more details, when it comes to product recommendations, deeper ones, you need to send me a private message. I'll do a skin consultation with you because a lot of hyperpigmentation can be a form of illness, can be disease related. So I need to know. But this person is asking me to prescribe products. Unfortunately, I cannot do that. I said few things about remedy. I talked about glycolic acid. I talked about licorice. I talked about niacinamide. I talked about vitamin A. I talked about salicylic acid. I talked about hydroquinone. I think that should be enough. Okay. But if you want me to start calling out products to use that you can buy in the drugstore, you have to contact me privately for that. Thanks for all this good info, Chica. Let me go beautify myself. Okay. Okay. Try and financial therapist. I've told few people about your channel. Try and publish your video tomorrow, please. Okay. Try and publish your video tomorrow. Does anybody have any more questions? Because I'm trying and I need to finish with this now. I think that's it now. I've talked for about 2 hours. Talked about for 2 hours. If you don't have any more, Magdalene, thank you so much for everything. Okay. You're very welcome, Magdalene. I hope I helped you. I hope you found the life you found it helpful, and I thank you so much for joining. And please don't forget to join me next time when I'm live, because I need your support. Okay. This lady, this Magdalene I need to talk about her. She's been like a huge supporter. She's been, since I opened my YouTube channel, she always watches my video. She always comments on my video. Oh, I don't know. I don't know. Thank you so much for your support. And even before my life started, she was already here before me with Little Staniford. She was already here before me. So whatever that I'm doing that you're finding worthy, find my channel worthy, to find my videos worthy to watch, I am very grateful. I'm getting very emotional actually. I'm very grateful. Thank you so much. And if you need any help with your skin, please send me a private message and I'll be very happy to to help. Please. Okay? Thank you so much. I appreciate all your support. And I have few YouTubers here as well that you can go and give some cake. I have a Max Forum here. Please give her some cake. I have financial therapists. Go and give her some cookie. I have Little standing for no. I have Abigail here. Let me scroll up. Chinwe's family joined today. Thank you so much. So Magdalene is a very good supporter. She's Nelo's Real TV is joined today. Please, Magdalene, can go and give them one cookie each, please. They are very good YouTuber, very good friends of mine, and they've been very supportive. K Gramon is here, was here earlier as well. Let me just start from the beginning. Nisha James, please. Abigail Ifoma, please go support Abigail Ifoma. Go give her some cookie. She's very good. She's a very good YouTuber. Nisha James, please. This Magdalene, she is good. She, like, when she's supporting you, she supports with everything. I don't even know her. She's just a good fan. She sent me one private message one time about one of my recipe, and that message, I've not some messages I will delete, but that particular one, Magdalene Izu, that particular message that you sent me, I still have it, and I'll go back and read it. So you are one of those people that made me to open this YouTube channel. You're one of those people that made me to open this YouTube channel to teach skincare. And very soon I'm going to have a one-on-one, at least because I need to see your face. I need to see your face. I'm going to have like a one-on-one video chat with you. I need to see your face because you've been so supportive. You've been so supportive. Thank you so much. Thank you. I appreciate you, okay? Now I'm just looking at all the questions here. So many of them. I don't think I can answer anymore. You're very welcome. I love your recipes. They're so good. Oh, look at that. Look at that. It's amazing. It's amazing. Like you're making me very emotional right now. You're making me very emotional. You know, you're making me very emotional. Thank you so much. I appreciate that now. I really, really do. You teach from your heart. Oh, look at that. Look at that. A lot of people have told me that. I guess it's just because I'm doing something that I have passion for. It's just I've been doing this for more than 12 years and I don't think I want to do any other thing. I don't think I want to do any other thing apart from skincare. It's just I don't think I want to do any other thing, you know? Now, does anybody have any more questions to ask me before I round this up? Hmm? Thank you so much. She's right, Chika. You are beautiful and very genuine. Ah, even Lita standing for to the same. You've been since I opened my YouTube channel. You've been there as well. You've been there. You watch some of my videos and you leave a very, very, very genuine, good comment. I appreciate you all. I'm grateful. Who is the other one? Is another Megan Micah Megan Mecca. Oh God, I don't want to bite my tongue now. She's good as well. She's always watching my videos. I'm grateful. I'm grateful for you ladies or you guys. Thank you. Thank you so much. So I'm going to round this up now and I'm looking forward to seeing you again in my next live video. Okay. I appreciate you all. And remember, Chica loves you. Okay. Take care of yourself and thank you so much once again for joining. And for other YouTubers that took out their busy time to join this live, I appreciate you all. I'm grateful. God bless you. Okay? Take care. Bye. I hope I did. I hope everything that I did, I did it well. Whatever questions that I answered it well as much as I can. Thank you. Thank you. Thank you. Thank you. No, questions are still coming. Questions are still coming. My goodness, no. That will be for another life. Maybe during the week. I think I should be doing this live like 2 times a week. Yeah, 2 times a week maybe. Because I don't think once a week is enough. It's not enough at all. Ending this now.